Hi, I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and New York and tri-state community. It's my pleasure to have someone very special to me, Dr. Mayank Parikh, who is a pharmacist and a PharmD, and we'll talk about what a PharmD is in a few moments. He works at Super Health Pharmacy on Staten Island, and he's going to help us figure out a lot about what the pharmacist's role is with regard to healthcare. Pharmacy's come a long way in many years, and the knowledge and the respect I have for pharmacists is tremendous. Pharmacists teach me a lot about drug interactions, what medicines to use, what medicines may be available to our patients, what could actually be paid for and accessible. When I spoke to Dr. Parikh, and we've become friends, Mike and I, the idea of his pharmacy was one of the first on Staten Island that were giving out vaccines for COVID. So we're going to really jump right in, and I'm going to really just say welcome, and thank you so much for coming. And tell us a little bit about what a pharmacist is, and what is a PharmD specifically, and what kind of schooling did you have to get there?
First of all, Dr. Perel, thank you so much for having me today. Truly is an honor. So what is a pharmacist? Myself, I've been a pharmacist for almost a decade now. Wow, can't even believe that. And I've been in the pharmacy field since 2007. When I was in college, I started working at the Veterans Affairs Medical Center in Philadelphia. And so what I was doing there, I'm serving obviously under the pharmacist. So typically what a pharmacist does, and in most folks' eyes, is pharmacists are just in the retail setting, meaning they're behind the counter just counting their medications. Now that has completely changed over the last 15 to 20 years. Before you had your normal pharmacist, or they used to call them a druggist, a registered pharmacist. Now that role and degree has significantly changed, where we're not only pharmacists, but we're doctors of pharmacy. So what does that mean? Do we get to call ourselves a doctor by name or trade? Yeah, of course it's nice, but what that really means is that, you know, we have a much more extensive clinical training, which allows us to not only practice in the pharmacy dispensing prescriptions, and that's only one pillar of what we're doing now. It allows us to give vaccinations, going all the way from flu, pneumonia, shingles, all the way to now the COVID-19 vaccine. It allows us to do testing in the pharmacies as well, testing for now COVID, A1C,
A1C is for diabetes, for sugar testing.
Yeah, A1C for diabetes sugar testing, or 90-day average. We're doing those things. And some of the training to get the doctor of pharmacy degree, you have to go through typically a 6-year schooling program. So you have 2 years of your undergraduate studies, and then you have 4 years of professional studies. And in that 4 years, you have in all the studies and the on-site classrooms, you also have extensive off-site in the field, doing rotations in hospitals, community pharmacies, in your second professional year. In your final year, 4th year, that whole year is strictly dedicated to doing your clinical rotations, whether it be at a hospital, a pharmacy, pharmaceutical companies. So pharmacists are really not only just behind the counter now, but really in patient care teams in the hospital, doing rounds with them, providing expertise on drug interactions, providing their input on dosing. And now in a lot of settings, pharmacists are also able to prescribe under different standing orders with practice agreement with the physician.
And that's actually amazing. I mean, I work so closely with pharmacists. Tell us a little bit about, and again, just not to just harp on retail, but the idea of a lot of my patients, a lot of people go to some of these very big chain firms. Some people go to more of these mom and pop, smaller firms, smaller companies, smaller pharmacies. Yeah. And there are advantages to both. I mean, there's buying power, and there's more, you know, it's maybe supplies you would need in your home, maybe at some of the bigger stores. In my own, and this is me speaking, not you, I've always had much more success and much more of a relationship with the local pharmacist. I have a person I could speak to, ask them a question about something that I'm concerned about, and really help our patient get the medicine to them. with regard to cost, with regard to figuring out what might be available to them. Tell me a bit, how did you pick your field about going at Superhealth, and how you decided that you wanted to be at a smaller pharmacy on your own rather than at a big chain?
Right. No. So, what sparked my initial interest in medicine was my father, my late father. He was a nephrologist and internist for over 30 years. So I always kind of worked under his wings, seeing him, the care and the love he provided his patients. Similarly, how I see you, I see a lot of that, which is really nice and warming to me. So I knew I always wanted to do something in medicine, and then I had no idea that a pharmacist could work in this sort of capacity. So my father said, hey, why don't you look into pharmacy school? 6-year program. And when you start it, just start it, don't look back, and just complete it. And I did, and I'm so grateful that I did, because I knew I wanted to do medicine, but I didn't know if I can commit to med school and the years of fellowship and residency, which God bless those folks that are able to. So I went to pharmacy school, graduated, and then I was working for the chains, actually. It was the first job I was able to get out of college. Being that going to school is expensive, I wanted to make sure that, what I was able to afford student loans or the cost of living and what have you. So I got a job with the chains. I got some extensive experience. And the difference between the chains and the independents is night and day.
I like that term. It's better than big. I like that.
Yes.
Chains and independents.
Chains and independents. And we're really not, it's not that we're fighting with each other or anything like that, but there's also wonderful pharmacists who work at the chains as well. But it's a corporate structure, meaning that you have a lot of Wall Street and other investor influences when you're working at a chain. And I'm not going to knock the chains, because I got a lot of my learning and experience from the chains. And then an opportunity came along. I was working at one of the chains, and they got acquired by another larger corporation. So I knew at that time I had to make some changes. And an opportunity came along on Staten Island for me to open up my own independent. I knew I always wanted to open up my own independent, because the capacity that you can spend time with your patients, you're not only a number in a chain of 15,000 stores, and the patients are not just mere numbers or metrics. You can spend that extra 15, 20 minutes getting to know the patient and doing things that you enjoy, love doing. Main reason why I went to pharmacy school is to be able to build that bond with our patients. They have my cell phone number. The doctors in the communities have my cell phone number. They can reach me anytime. And the decision-making power is really with me. So if I want to go out and do a vaccine clinic in 2 hours, I could do that. And independents traditionally have always been the cornerstone of every community. But what had happened now with a lot of the consolidation in the industry, the insurance companies, reimbursements, all those things have driven a lot of independents to close their doors. Not because they're not successful at what they do, it's really a lack of resources when you have a David and Goliath sort of scenario, meaning the independent pharmacies and the larger chains. Now the insurance companies too, they're getting acquired by a lot of the larger chains. So that also puts a strain on the independent. But if you go to any independent, and I always tell this to any of my family members, hey, you go to any independent, you're gonna know the pharmacist by name, they're gonna know you by name, and anytime you need them, you call them up and they're gonna be there for you. If you need the medicine the same night, if they have to get the medicine an hour away from another store, chances are they're gonna make it happen for you. And that's just not my own Superhealth pharmacy in Staten Island. I guarantee you, you go to any corner mom and pop store, they're gonna be vested in the community and they're gonna be vested in your overall better health.
So let's jump into a little bit about the science and the medicine and the pharmacy of this. How has COVID-19 affected you and the pharmacy?
So it's, COVID-19, of course, terrible pandemic that we have faced. We've lost so many good folks to this terrible virus. Now, speaking on strictly the professional and pharmacy aspect of it, 18 months ago, if you asked me, what is your pharmacy going to be looking like in 18 months? It would not be what it's looking like today. Completely different. Our pharmacies have been converted into full service testing centers, which means that we're doing COVID-19 testing, and that has also evolved into flu testing, strep testing, So patients can come and do these things at the pharmacy level, not have to, have to book an appointment. And pharmacists traditionally are always the most accessible healthcare provider in the community. You can go into any pharmacy and ask to speak to the pharmacist, and chances are you'll come across a doctor of pharmacy behind there. So they'll be able to use their clinical judgment and expertise to answer those questions. We're also doing a robust amount of vaccinations now, meaning anywhere from COVID-19 vaccines. Now it's flu season, which I highly recommend everyone get their flu shot as well. And the CDC has stated that you can get the COVID-19 vaccine with any other vaccine, irrespective of timing.
So tell me about if someone wants to come in to get a COVID vaccine. I mean, we do that at the hospital. There are a lot of centers that New York City has set up for COVID. Do patients decide which vaccine to get? Do you decide which vaccine to get? What kind of a decision-making process do you make with the patient?
That's a great question. So a lot of patients come into our pharmacy knowing knowing what vaccine they already want, meaning that they have discussed it with their primary care doctor or their family and made a decision. Currently, and record-breaking, groundbreaking research has been done to come out with the 3 different vaccines we have right now, whether it be the mRNA ones or the Johnson & Johnson. So patients come in, typically the folks who are, and we are more than happy to answer any questions, because our job as pharmacists is not to force anyone to get the vaccine. It's purely to educate them and provide them the facts. There's so much information out there right now. So patients are really confused. They don't know what to believe. And even to the pharmacists or the doctors, so much information out there. So we have to be able to help the patient decipher that information. So we tell them the facts, say, hey, these are the vaccines that have been out. This is how long it's been out. What are your concerns? What are your fears? And based on that, we can make a suggestion, say, hey, this is what we're giving at our pharmacy. If you get the Pfizer vaccine, the second dose will be in 21 days. It's an mRNA vaccine, meaning that it's going to use the messenger ribonucleic acid to induce the spike protein, which then will help your body create the antibodies. And
but of course, it's a not live vaccine.
It's not a live vaccine.
That's important for our patients to know, of course, that these vaccines are all very safe and that all of them are not live vaccines. And again, we hear different stories about Moderna, about Pfizer, about Johnson & Johnson, and different side effects. And they all have issues, but they've all been overwhelmingly successful in treating COVID.
Yeah, absolutely. And patients are concerned about altering their DNA. That does not happen, clearly. And same thing with the Johnson & Johnson, creates the viral vector, more traditional to kind of how vaccines have been out there for a while. And right now, we tell all our patients that, a lot of the concern is, hey, this is brand new. How can I trust this? But mRNA technology has been studied for many, many years now, and they have been able to. It's like a an advanced version of the traditional vaccines we were getting. Typically, you'd get a vaccine; it would be a live vaccine or a dead virus of the vaccine. But now you're skipping all that and going straight to your body to create those antibodies with these spike proteins. So it's really marvelous, this technology that has been created by these companies.
But it's very interesting that patients usually know which of the vaccines they want to get when they come in.
Yeah. A lot of patients, they know which vaccine they want, whether they have discussed it with their doctor or they know the family member got either Johnson & Johnson, Moderna. A lot of the folks who are a little more vaccine hesitant, they have been choosing to get the Johnson & Johnson because it is the single dose. But a lot of those folks are now also coming back for a second dose for the booster, as it is approved for anyone over 18 years and older, and after 2 months after their first dose for the Johnson & Johnson.
And I don't know if you're seeing kids, but again, one of the vaccines is now being approved over 5 years of age.
Yeah.
And hopefully over the next few months, we'll even get younger and younger people. So let me jump on to a different topic. So I think it's marvelous that you give this service, and I never thought of it, but you're absolutely right. That probably if somebody wanted to see a healthcare provider, professional, in as quick a way as possible, it's probably easier just to walk into your pharmacy or any pharmacy and see someone who could discuss your medication, some of your conditions, some of your concerns, than it is to wait in an emergency room, an urgent care center, or other places. So it's a very interesting concept. So let's go over a few things that always was mind-boggling to me. I never understood over-the-counter medicines. And if you give a medicine like Motrin, ibuprofen, in a small dose, it's over the counter. If I take 3 of them, it's a prescription dose, or 2 of them. And the idea of how it's regulated And again, and that's why I think pharmacists are so important. And maybe another part you could tell us is, especially in whether it's your store or even in one of the larger chains, I think independence versus chain, right? Whatever word we use. The idea is, how do patients know which of the medicines to take? I mean, I'm sure they talk to their pharmacist if they've got a headache, which as a neurologist, I try to have them avoid certain caffeine-containing products, and I sort of cringe, but I appreciate the FDA has approved some of them. But also just for common issues, and again, we know their medical history is so important. How do you discuss with people the over-the-counter thing of medications? Really how important it is and how it really is a medication and not just it's not just nothing. It's just a real medicine.
Absolutely. You hit it right on the nail, Doc. It is so critical that you and your pharmacist are on the same page with your medication. A lot of times folks are trying to, and I get it, times are rough, everyone wants the best price for the product, right? But a lot of the folks they may be missing is the community pharmacies are able to get you those same prices. Mm-hmm. And why am I mentioning this? If your local pharmacist is able to manage all your medications, right? Not having to go through the mail order, not going to an online pharmacy, telemedicine, what have you. You have your local doctor, you have your local pharmacist. They know exactly what medications you're on. You ask them for an over-the-counter recommendation, and someone's like, hey, Mike, I'm not feeling too well. I want to take an aspirin or I want to take a Motrin, and they're on other blood thinners. So we're going to be able to make a recommendation to say, hey, listen, these medications, non-steroidal anti-inflammatories, they may put you at an increased risk of bleeding. So based on their profile, and patients may not think that, hey, it's over the counter, it can't cause me any harm because it's been marked safe by the FDA, and they see different things online. But if you go to your pharmacist for a recommendation, and 99.9% of the time, they're gonna be available to answer those questions for you, especially at your local community pharmacy. They can review your profile and say, hey, listen, Ms. Smith, you're going to be fine taking this, or instead of this, why don't we take this so that way it doesn't cause any interactions. And that's really the key here. We want to prevent any accidental over-the-counter medication interactions. So if your pharmacist is able to review those things and, based on that, make the best recommendation for you. And that's really what we do. And you mentioned if you're taking so many of a pain medication as ibuprofen, why do I have to get it via prescription? Great question, right? You may already be on another pain medication that has that ingredient in there. A lot of times we see patients on Tylenol-based products and they don't even realize it, and then they get another Tylenol product, which we're able to stop that there and say, hey, listen, you don't want to take both of these together because ultimately it really is the same medication.
So it sounds like it's very important that you have your pharmacy needs done at the same pharmacy.
Very important.
So, and in New York State, they came up within the last couple of years of electronic prescribing. Right. So our prescription pads are becoming somewhat antiquated. Yes. They're just there for if I want to order an X-ray or start some physical therapy or do something else. But really, most times we don't give prescriptions to patients anymore. We're not giving them a little piece of paper to go. What you're doing is it electronically. And I'm thinking, what are you seeing a lot of benefits, or what benefits are you seeing with this electronic system?
The benefits are tremendous. Now, not only are we able to prevent any minimal errors that could have been by a handwritten prescription, everything is...
And that means handwritten, so let's talk about doctors' handwriting. Yeah. So a lot of times there have been prescriptions that have been misread over the years.
Yes, that does happen. Even, reading my dad's handwriting throughout the years, I had no idea what it was until I went to pharmacy school and learned of all these things. But yeah, electronic prescribing has really put a big stop to any mistakes that could potentially happen. Also, it's preventing a lot of the polypharmacy too. Patients going to different pharmacies, shopping around. If the doctor sends all your prescriptions to one pharmacy, chances are you're going to go to that pharmacy and get them. As opposed to handing the prescriptions to the patient, they might shop around, which is not a problem. But if you're going to 8, 9 different pharmacies, that's going to cause a big problem for the pharmacist trying to manage your care.
And especially if you go out of state. You tell me, years ago there was very little communication between, say, New York, New Jersey, Connecticut. Yeah. You could take a paper prescription to a different state and really get it filled also. So tell me what's going on with that.
Yeah, so patients are still able to go across states and get prescriptions filled. But with the electronic side of it, even the other states are moving towards that. We have a controlled substance monitoring program as well. So if a patient gets a prescription filled in a different state, we can automatically see that based on what the New York State has put together. And as far as over-the-counter or prescription medications go, electronic prescribing is really the future and ultimately the best way to go for the patient, the doctor, and the pharmacist.
I know you well, and you're a wonderful pharmacist, a wonderful clinician.
Thank you.
Tell us any interesting stories, any interesting patients that even pre-pandemic, during the pandemic, or hopefully now towards the end of the pandemic, that really have affected your life, and you've seen and you've been able to help through your education with the patients.
Yeah, absolutely. I mean, I can tell you 100 different stories of the patients really bonding with me on a personal level. When I started my pharmacy, we were doing 0 prescriptions. We had 0 patients, so we built everything from the ground up. And, when you went to your pharmacy, 40, 50, or the folks that know the independents before the chains were around, you just go in there, patients would sit down, you have a coffee, give them hugs, and, you just knew everything about the person. You knew what's going on in the pharmacist's life and the patient's life. And one particular patient that we had is another thing pharmacies also do is Narcan training, which is many years ago.
Tell us about that a little bit.
Yeah, so in 2016, 17, when I first opened my pharmacy, I saw there was a big void in pharmacies working towards training patients on Narcan and what Narcan is, and the stigma behind the opioid epidemic, and being addicted to opioids, patients didn't want to talk about it. So one particular instance, I had one patient that we gave Narcan to, and he was just, he didn't have any opioid problem, but he knew patients and family members that did. So we trained him on proper training and how to use it, and we've trained over like 300-400 people on Narcan in that, I think, 18-month span. And that single patient, he was able to save 2 lives with the Narcan that we dispensed. And every time he comes in, we just talk about it and say, hey, listen, I'm so happy I came in that day and you took the time out and told me what Narcan is. Because, when we mention Narcan to people, people are like, well, forget it. Opioids, no, I want nothing to do with that. But, lo and behold, that it's really not just for you, right? The patient who has this disease, really, of addiction, but the caregivers, the friends who know that patient has this problem, then you're really able to help them.
Do you believe that everyone should have Narcan in their house?
I do.
Be trained?
I believe so, because studies are showing that, at your home, the medicine cabinet is where a lot of these issues start and the problems start with drug abuse.
So if someone accidentally overdoses on someone's opioids or narcotics, the idea that you can give them a nasal spray, or that's usually the mechanism of giving Narcan, basically you could save their life.
Yeah, absolutely.
And if someone has any kind of an overdose, whether it's accidental or intentional from someone else, this is really a very pivotal thing. Most times EMS can't get you home in time, especially if you stop breathing because of these medicines. So it's a very, very interesting concept, and I think a lot of this is covered also by insurances, that they're allowing people to have a Narcan dose in the house. I think New York State has made a very big deal about that.
Yeah, they have. They've done a tremendous job all the way down from the Department of Health, which I worked with, to launch a lot of these initiatives with them a few years back.
Just in the last few minutes, I'm going to talk about cost, and here are things that I love always having a guest that knows things that I don't, and I'm able to learn. I watch TV commercials, and whether it's a coupon, credit, Good RX, whatever it is. And the concept comes to me, why if I have a card would I get a discount compared to if I don't have a card? And I understand that somebody might be subsidizing it from somewhere, but how does that all work? And should everybody get these cards? Do pharmacies have these cards? If I didn't happen to have the card in my pocket and the pharmacist has one, because there's nothing specific for me on it, it's just a general card. And I don't understand that. And because our patients, we need them to get their medicines. As a physician, it's become an onerous task to try to get approvals for all the medicines. And I'll actually look right to my audience and say, it's not your doctor's fault if the medicine is expensive or your insurance company doesn't pay for it. It's not always as easy as writing a letter or writing a note. Sometimes there's just blocks in the system that will take days, weeks, months, and they force us to use trials of other medication. And really what you do, with your pharmacy and help us trying to get through these prior authorizations and trying to we have a common goal of getting the right medicine to the right person in as timely a manner as we can. So tell us, and please, and tell me and tell everybody, all these viewers who are out here, how do you get it really done? And you only have 2 minutes to do it, but how do they really get it done?
So this is part of what we do, especially on the independent pharmacy side. Our ultimate goal is to, as you said, get the patient the product the doctor wants the patient to get. Whether that means if the insurance isn't covering it, if it needs some prior authorization edits, or if we need to get the patient a coupon as to walk them through the process of getting one. Because a lot of the branded products, the new medications that are coming out, they do have assistance programs available to the patients, which they may not even know about. So that's where we really take our time out and help the patient save money and get the product the doctor prescribed, number one. Number two, a lot of the generics on the market, 200-300 top generics, are really inexpensive. So if you see commercials on TV, GoodRx, SaveRx, all these things, if you simply go to your independent pharmacy and say, hey, you come into my pharmacy, hey, Mike, I need this medication. I see it's for $4. Are you able to help me out? I guarantee you 90% of the time, that pharmacist is going to be able to get you that price. You don't need to use any of these discount cards out there. Go straight to the pharmacy. And what is a discount card? Those discount cards you see on TV, that's just another middleman. You don't need it. Go straight to the pharmacy, and the pharmacy will be able to give you that service or care medication that you need. But when you talk about the branded medications, of course, they're a little bit more pricier. So there are plenty of discount programs available. If their insurance is covering it, they have copay assistance programs. If they're not covering it, they have trial programs to get them through until the insurance does cover it, and hopefully they do. But really, that separates, I would say, the independents from the chains, because, and not that the chains don't want to do it, they just don't have the time, right? So we're able to take the time out and really help the patient save money.
I think since COVID, interestingly, one of the advantages or things that I've seen that have occurred is the publics and the physicians and healthcare providers really respect and work with the pharmacists. The idea that you guys have places that are giving out vaccines, some of our medications, especially with all COVID-related processes, have been different. So we all had to learn a lot, and we're all on this very cutting edge together of learning new medications, and with all the new medications that are out there. And I think just the idea of working with someone like yourself and your wonderful pharmacy at Super Health and all the things that you do really has changed the way I view pharmacies, a pharmacist and a pharmacy's interaction. A lot of times we were just saying, we would almost be obstruction to each other. When we'd say, we get the medicine, we're not, I can't believe I'm having such a hard time. And I think right now, especially during these hard times that we've all been going through, this symbiotic relationship, how we work together, really has changed the way physicians, healthcare providers, pharmacists all work together. And I think if anything, that was something that wonderful that we have. So I want to say thank you for coming. It was a pleasure. You've been a wonderful guest.
Thank you.
Thank you.
Thank you for having me. I appreciate it.
Have a good night.